welcome to today's edition on Health Talk with Fifi. My name is Steven Sabla Ansan, aka Fifi, and welcome to today's edition. And today we would like to talk about a very important disease that is affecting the world, Africa preside, and even Ghana. So we would like to talk about this disease. Before we continue, we spoke a lot about other diseases. Before we say anything, or if we find anything, any contribution to give, we advise you drop it in the comment section so that others can also pick and learn more about it, because I believe we are all learners in this health field. So today we'll be talking about malaria, and I have with me a nice gentleman who will be explaining so much or open our mind in this disease called malaria. So welcome, Mr. Isaac Osei.
Thank you very much.
Oh, okay, nice accepting my invitation.
Thank you very much.
Okay, so what is actually malaria?
Okay, thank you very much, Mr. Fifi, and thank you for our viewers also watching us. When we talk about malaria, as we all know, is one of the most dangerous and very scarce or prominent disease that we find here in Ghana. And so it is part of the 6 killer diseases. Malaria, as we all know, according to statistics, for the 2022, that's last year, for the whole world, we had about 241 million of people worldwide having malaria cases in most laboratory, in most hospitals. That we had about 6,000 and above people dying of malaria. So when you talk about malaria is one of the deadly diseases that we have in Ghana, but we don't pay much attention to it. So malaria is one of the deadly diseases in Ghana here, and it's very important we take heed to malaria and we treat it very well. So that's
we now know what malaria is. It's a disease. Okay, so what actually causes malaria? Is it flies? Is it what causes it? We don't really know much about it.
So malaria is caused by an infected female Anopheles mosquito. So we have different types of mosquitoes, but malaria is caused by a particular type of mosquito strain. So it is the female or infected female Anopheles mosquito. So what happens is, when this infected female Anopheles mosquito bites an individual, so let's take me for instance, I become the host. So, I become the host when the parasite bites me. So when he bites me, he injects the Plasmodium parasite into me. And so what happens is this parasite moves into the body, into the bloodstream, into the liver. From the liver, it enters into the bloodstream. So this parasite mostly feeds on the red blood cell.
Oh, okay.
So you see people having malaria when they go to the hospital, you check their full blood count. You see that they have low HB levels. This is as a result of these parasites feeding much on the red blood cell. So people having malaria, they portray so many kinds of symptoms as a result of this malaria parasite feeding on the
red blood cell.
The red blood cell.
Oh, okay. Now I now get the whole picture. That's why most of them, they have low HB count.
Yes, they have low HB count because of the malaria parasite feeding on the red blood cells.
Oh, okay.
Because the red blood cell is very important. They play major roles in the system. So they help in carrying oxygen. They carry some vital minerals, and also carry water as well to the various parts of the body.
Oh, okay. So we say, like, what are the signs or symptoms? How are we going to know we are being affected with this parasite?
Okay, so we have so many symptoms that when someone is having malaria, the person portrays. So, so after the malaria has bitten the individual, the person will start portraying the symptoms within 1 week to about, or from 10 days to about 27 days. So you would see the person portraying some symptoms like fever, you get headache, chills, nausea, vomiting. So I want to correct something. Fever is not a disease.
Oh, okay.
So fever here is a symptom. So it is not a disease. So you should take note of that. Most people go to the pharmacy
Yes,
and they'll
yes,
be like,
yes,
oh,
yes.
doctor, pharmacist, please, I'm having fever. So fever is not a disease. So
Yeah, that's
actually
true.
fever is a symptom that these parasites or some of these organisms release as their mechanisms. So a person who portrays this fever, headache, you feel chill, very cold, then dizziness, fatigue, then also vomiting. So these are some of the symptoms that you portray when you have malaria.
Oh, okay. So how are they how is malaria diagnosed?
Okay.
How is it treated?
So most of the times when you start experiencing these symptoms, it is better you go to the hospital for them to do a proper diagnosing on you. It is not always good for you to do self-medication. Because you start portraying that symptoms, you'll be like, oh, then let me visit the pharmacy and
Yes,
get
yes,
some
yes. Most of the people, they do it.
It's never advisable to do that.
Okay.
So the best way to go about this is when you start showing these symptoms, you go to the hospital, you explain how you are feeling to the doctor, and the doctor will tell you to go to the lab for a further investigation. So most of the time we take your blood sample, we do some of the tests like full blood count, we do a malaria test. So it's either we use the serological technique, that is maybe the RDTs, or we go with the MPs, the BF for malaria parasites. So these are some of the tests that we do when you come to the hospital.
Okay. So how is it? How is it treated? We mostly forget about this. The treatment. We just take anything. Just some people can just you know something. There is this leaf here. This leaf can heal you. This leaf can do this for you. Please, what's your take on it? The treatment.
So with the treatment, we have so many drugs that we use in treating malaria.
Okay.
But the most common malaria drug is the artemether and the lumefantrine. So both of them play a vital role in treating this malaria parasite. And the malaria, as I said, the mosquito strain, we have about 5 of them.
Oh, okay.
We have about 5 of them. But the ones we experience here in Ghana is the Plasmodium falciparum.
Okay.
Then you also experience the Vivax and Ovale.
Okay.
You also have Nolesi. But the most strain that we experience here is the Plasmodium falciparum and the Plasmodium vivax. Plasmodium vivax, it's not usually seen, but as compared with the falciparum, we usually see them in Africa, West Africa. So we have the artemether and the lumefantrine, which we use, and now there are so many drugs outside that are certified by the FDA, and people are using it to treat malaria as well.
Oh, okay. So thank you very much for today's calling. Thank you very much. I think when we need anything, we would like to call upon you, and we will be very happy if you respond to us accordingly. And please, how can we prevent ourselves from getting this malaria, or what can we do to?
Sure. Malaria, we can prevent ourselves from getting bitten by this mosquito by sleeping under treated insecticide mosquito nets. We also have insecticide sprays and coils that we use in our rooms. Then we should keep a clean environment. That is the most important thing. It is very important we keep a clean environment, which will really help us, not only with the mosquitoes as well, but our health is very important. Then some people also practice what we call the zoo prophylaxis. But in Ghana here, we don't usually do the zoo prophylaxis. This zoo prophylaxis, it's like you having you rearing a particular strain of animals. So like you have cattle there, then your house is far away. So when the mosquitoes are coming, they will go and breed on the cattle rather than coming to your place. So that practice is usually done by some people outside, but not in Ghana yet.
Oh, okay. Thank you very much. Thank you very much. We really appreciate it. Okay, so what we have to say is you've already heard everything he said. And before we leave this program, I would like you to drop your comments on the comment section. You like the program, you subscribe, so that when there is more videos, you can be able to get a notification. Subscribing doesn't mean you are paying anything. No, you are not paying anything. You're just subscribing to my YouTube channel or other channels or other platform that you see this video. Thank you very much and see you next time. Bye-bye.